Hello, my name is Don Randolph. Welcome to Healthcare Genius 2012. I am a married father of 4. I'm an Air Force veteran. I'm a business owner. I'm a financial advisor. I have been since 2002, and this comes up a lot in my meetings with folks. I have a bachelor's degree in finance, and what I want to do today, and I realize everybody has a short attention span, so I'm going to keep it pithy as much as I can and keep it quick. Basically, healthcare started out, it was just you and the doctor. There was a doctor-patient relationship. The doctor might even actually come to your house. And whenever you got sick and the doctor came and healed you, you paid the doctor directly. And again, that helped establish that doctor-patient relationship. People knew their doctors very, very well. And then sometime in the last century, with the Industrial Revolution and large-scale employers began to say, if you will come work for us, we will set up with an insurance company so that when you get sick and go to the doctor, you don't have to pay the doctor anymore. The insurance company does. And what that did was, and the reason the employers did this was as an incentive to get people to work for them, but it was very inexpensive at the time. It cost the employer practically nothing to set this up. And this was the model that the United States healthcare system kind of got going on, but as everyone knows, it has a flaw, and the flaw is that it destroyed the doctor-patient relationship. The individual has no incentive under this model to manage their own health care or their own health care costs. There's nothing to stop this person from going to the doctor 3 times a week for the same ailment because, well, whenever you get a doctor bill, do you ever look at your doctor bill?
No.
Why? Why is that?
Because the insurance will be paying for it.
Because the insurance pays for it. If I don't have to pay for it, why do I have to look at the bill? So what that led to was ever-expanding healthcare costs, which for a while the employers bore the brunt of, but eventually it got so big that they said, look, you know, you're going to have to pay the insurance company also. And so then money started being held out from people's wages, and co-pays came along, and it just kept getting bigger. And of course, healthcare providers figured out that they get paid more on a per-procedure basis, and not so much are they keeping their patient healthy. Now, sometime in the late 70s, as the cost kept getting bigger and bigger to try to alleviate that, flex spending accounts were created. And flex spending accounts, or medical savings accounts, were basically like little savings accounts with the insurance company where you could put money in an account to pay for your health care expenses with pre-tax dollars. But the flaw with FSAs was if you didn't use the money by the end of the year, you lost it. Well, that led to a lot of waste, people buying cases of aspirin at the end of the year to avoid losing that money. In the last few years, flex spending accounts were modified into health savings accounts, in which you did not lose the money at the end of the year. It rolled over to the next year. The individual got to keep the money. And the idea behind HSAs is that it gets employers out of the insurance business. Employers want to make widgets. They don't want to be in insurance. So if you eliminate this link and the employer pays the individual, and this is a sticking point because the public would have to be educated about how this would work. And let's just say, for example, it costs $6,000 a year to keep someone insured. If they get a high deductible health plan with a $3,000 deductible, and let's just say for argument's sake that plan costs $250 a month instead of $500 a month. Now, if the employer pays the employee the difference, the employee has to be educated that you can't just spend that money. That's healthcare money. You need to set it aside in an HSA. That's $250 a month times, if you're healthy for 1 year, now you've got $3,000 in that account. Well, what if you're younger and you're healthy for 10 years? That's $30,000. Well, now we're getting into some money. And let's say, for argument's sake, that this individual in the 11th year has a major medical event, whether it's a car wreck, heart attack, whatever it is a $100,000 medical bill. Well, they have the money to pay that deductible. The insurance company is on the hook for the other $97,000. That's what they're getting this premium for from everybody. And don't forget that the individual, if they're still contributing, they end up with the $30,000 that they started out with in that year. And whenever they turn 65, they can use it for long-term care, they can use it for retirement income. Lots of options there. Now, this was kind of the way healthcare was evolving all by itself. Necessity used to be the mother of invention, and it still is if it's allowed to. But what this did was, besides being more efficient and getting the individual to pay attention to their medical bill, it also began to reestablish this doctor-patient relationship. I guarantee you, the doctor knows more about your insurance company than they know about you. Why? The healthcare provider is always going to pay the most attention to whoever's paying them. And if the individual is paying the doctor instead of the insurance company, that starts to reestablish that relationship. Now, this is kind of the way, and if you do this, it's good for everybody. It's good for the employer because it gets them out of the healthcare business. It's good for the individual because if they eat right, maintain a good weight, if they take care of their health, they get to keep the benefits financially. It's good for the healthcare providers because it reestablishes the doctor-patient relationship. It is also good for the insurance companies because instead of processing millions of claims for a few $100s each, the only time the insurance company gets a claim is if it's a big one, if it's $97,000. So the administrative costs for the insurance companies is dramatically reduced, saving millions, billions of dollars every year. Now, that was kind of the way healthcare was going all by itself. But then the Affordable Health Care Act of 2010 was passed in March of that year, and this is basically what happened. Government now effectively is going to control all the insurance companies. They will dictate, the government will, what an insurance company can charge. They can also dictate what they have to pay. All employers, mandatory, have to pay into this or pay a penalty. All individuals, individual mandate, have to pay into this or pay a penalty. Healthcare providers, if you want to get paid, you're going to have to fight us for every penny. And HSAs go extinct. Healthcare is complicated. Einstein said that simplicity on the other side of complexity is genius. That's why this is called healthcare genius. So how do you fix this? This is an idea. It's not perfect, but it's an idea to put personal responsibility back into healthcare. And it is a false choice. There are two sides, it seems, that one side wants government to be in control of healthcare. The other side wants insurance to be in control of healthcare. It's a false choice. The right choice is that each individual American is in charge of their own healthcare. How do you do that? Well, first of all, you put the individual at the center. Every person in the United States gets a health care card. It kind of works like an HSA, but on this card there are two things. The first is information. All of your medical records are stored electronically on this card, so no more stacks of paper. The other thing that's on this card is money. It's like a debit card or a gift card. You can put money on this card. So no matter where you are when you get sick, you can hand the healthcare provider this card. They have all your medical records and the funds to pay for whatever it is that you need. Now, this is the centerpiece. The individual gets the healthcare card from an insurance company, whether it's Blue Cross Blue Shield, United Health, Medicare, whoever. But the individual gets to decide, based upon their circumstances. Let's say that I'm going to get my health care card from Medicare, or it could be Blue Cross Blue Shield. It just depends. Now, each one of these have to be governed by government. You're going to have government in health care, but government doesn't handle any money. The insurance company is the custodian for the individual's information and the funds. Now, next question, how do you get money on the card? Well, first of all, the individual, you can put money on your own card and save up for a rainy day if you're ever sick. But also an employer, charity, government, or someone else, a relative, possibly. All of these can put money on someone's card. So if it's a child who has leukemia, and of course there's not much money there, it can come from charity, from a relative. It's sort of like the bucket at the cash register seeking donations. Now the only individuals, the only entities that can pull money off of the card are healthcare providers. So doctors, hospitals, pharmacy, long-term care. And there would have to be some kind of electronic coding on this so that we don't want the individual spending their healthcare dollars on cigarettes. But that can be done with the use of technology where only healthcare providers can pull, licensed healthcare providers can pull money off of this card. Now, one big hang-up, the only way it's ever going to work is if it covers everybody, every man, woman, and child in the United States. And this is just an idea. It'd probably be controversial, but when the individual passes away, they don't need their health care information anymore. They also don't need their health care dollars anymore. So the money on their health care card could be recycled into a fund that will provide for health care for the living. In other words, the health care dollars of the deceased would be used to provide health care for the living. And that's a sticky point. But that is a way of funding health care for those who are not able to fund it for themselves. This card, that's the key piece. That card is an accounting mechanism to track for every single dollar spent on health care for an individual in their lifetime. It's also an accounting mechanism for all of their health care records. This is simply a model that can be used to provide health care effectively and affordably to everyone. It reintroduces personal responsibility. It does have government oversight, but not government involvement. It allows the insurance companies to operate profitably the way that they see best, and they'll want to serve certain segments of society in different ways. But here's the key. The insurance companies are not in charge. Government is not in charge. The individual is in charge. The individual gets to choose who issues their card. They get to choose where they go to receive health care. And the individual is responsible for maintaining a balance on this card. Thank you very much. If you have any questions, send me an email, and it'll be on the video. That's it. Thank you.